Good morning and welcome to the Mental Health at Work Index Fall 2025 webinar. I'm Dr. David Ballard, Vice President of One Mind at Work, and I'm thrilled to have you with us today as we release our new focal brief, The Communication Gaps Undermining Workplace Mental Health Programs. At One Mind at Work, we know that effective communication is one of the most powerful tools that organizations have to build a culture that supports mental health. But we also know it's one of the most common stumbling blocks. Now, before we dive in, a few quick notes. Today's session is being recorded, so we'll share that as well as a summary afterwards. We'll have time for some questions from the audience toward the end of the webinar. Please use the Q&A box in Zoom webinar throughout the session. You can drop in your questions for the panelists, and we'll leave some time at the end to take some of those. So please don't stick those in the chat. Make sure to put them in the Q&A box so that we don't miss those along the way. And with that, I want to start with a little bit of a brief story. During World War I, there was a U.S. battalion that got cut off behind enemy lines, and they were under attack by German forces. And so no one could reach them. No one knew where exactly they were. They couldn't get messages to them. So they used a carrier pigeon, and a carrier pigeon named Cher Ami, which means dear friend in French, carried a message through the smoke and the chaos and enemy fire and actually got shot down. But it alerted American forces to the battalion's location so that they could be rescued. Now, we're over 100 years later at this point, and now we can send messages around the world instantly, faster, clearer to thousands of people, all at the same time. But the irony is we're still struggling with the very same problems. We're still struggling to make sure that what messages we send actually land. And technology has made communication faster, but not necessarily better. We can send emails, we can put internet posts up, we can send wellness updates in seconds. But if those messages don't reach people in a way that connects, that builds trust, and that feels human, they may as well never leave the desks of the people who are sending them. So that's what today's conversation is really about. How to make sure our messages about mental health get through and not just go out, because communication isn't just about efficiency and getting the message there. It's about empathy and connection. And that brings us to today's topic and what we found from the webinar. In our 2025 Mental Health at Work Index focal brief, the report takes a look at how organizations communicate about mental health and where these efforts are succeeding and where they're falling short. So a few of the key findings of what we learned. First, fewer than half, just 48% of organizations have a formal, consistently used communication plan. Only 28% update that plan regularly based on emerging risks and employee feedback. We found that most communication still focuses on individual level topics like benefits or self-care, and far fewer organizations are talking about team or organizational level issues like psychosocial hazards or stressors that people can face because of the way work is conducted, or crisis response plans and management. And although 86% of senior leaders express commitment to mental health, only 61% are regularly communicating about it, and only half embed it into their organization's mission and values. Now, on the positive side of things, we did find that organizations that do have comprehensive, transparent communication practices, those that are covering protection, promotion, and provision, our 3Ps that we talk about, experience half the voluntary turnover of those organizations with insufficient practices. So 9% voluntary turnover versus 18% voluntary turnover. So there's real evidence that effective communication is not just good for people, but it's also good for business. Now, let's talk about putting these principles into practice, balancing strategy with flexibility, creating meaningful content, and engaging leaders and employees alike. Now, today I'm joined by two incredible leaders who bring deep hands-on experience in workplace mental health and communication. Wendi Nosenchuk is the Senior Director of Health and Welfare Benefits at KPMG, where she leads initiatives supporting the well-being of more than 39,000 employees. Wendi has more than 30 years of experience in benefits, consulting, and health program management. She's been instrumental in expanding KPMG's approach to well-being, integrating emotional, financial, and physical health, and embedding those efforts into the organization's culture and strategy. Whitney Elyachar serves as a Chief People and Financial Officer at Big Brothers Big Sisters Kansas City. Whitney brings a unique blend of financial leadership and a people-first mindset. She's helped build a culture of care and accountability that strengthens both the mission and performance at the organization. Under her leadership, they've expanded their focus on mental health and belonging across staff and volunteers, earning recognition from the Kansas City Business Journal as CFO of the Year. I want to thank both of you for being here today and for the work that you're doing to make communication about mental health more intentional, more transparent, and more effective. So thanks for joining us.
Yeah, thanks for having us, David.
Yeah, thank you, David.
So let's start our conversation with how each of you thinks about building the foundation for mental health communication within your organization. So Wendi, let's start with you. The index shows that many organizations struggle to maintain a consistent communication plan. How do you balance planned strategic communications that are focused on your priorities with the need to stay flexible and responsive to emerging issues or workforce feedback?
So we have a strategy, and we pretty much plan for it for the year and, for the really upcoming few years. We know that there's certain things that we focus on, certain monthly events that we feel we need to bring attention to our people, specifically World Mental Health Day, Mental Health Awareness Month, where we do some pretty robust programming. And then we anticipate, the monthly breast cancer awareness and promotions like that, so that we can stay in front of our people and have familiarity with them and try to break the stigma around talking about mental health and some of these benefits. So that's our general overarching strategy.
Great, thanks. And Whitney, how about you? How do you balance those planned strategic communications with things that come up that you need to be flexible and responsive to?
Yeah, so I'd say each year we have a communication plan where we can map out each month what we're going to focus on with employees, kind of communications that we'll send out. And then throughout the year, we try to remain like vigilant about what our employees are experiencing or what's been relevant to us in the workplace. And so we'll do trainings each quarter. Some are like pre-scripted, where we say, okay, this year we want to make sure that we do like a harassment training or something. But a lot of them that focus around mental health, like are in response to what's happening with the families that we serve and what we've been seeing. And so recently we've noticed we've had more children enroll that are diagnosed with autism. And so we've had an autism awareness training. We also have had a preventing suicide training because our organization has been impacted by suicide this year. And so we try to focus like our training and our communication around what we see emerging and what our people could benefit from most. But we also like to go into the year with a plan in place as well, just to make sure we're really hitting all of our boxes, but staying reactive as well.
Yeah, thanks. That's a good transition to the next question that I had. You really got at focusing on issues that are important to the workforce and the kinds of things they experience on the job. I mean, the nature of work that's done there at Big Brothers Big Sisters, it exposes employees to particular kinds of stressors and hazards. I mean, the kind of work they're doing can be stressful in and of itself. And it sounds like you're tailoring some of the communication and training to address that, which gets at the protection aspect of the 3Ps that I talked about. What other kind of content do you include in there that spans that? Protecting people from the kinds of stressors they're going to face on the job, promoting positive well-being and healthy behaviors and things that have people experience positive aspects of work, and then things related to benefits and the provision of resources and information to help people if they're struggling or they need to tap into those resources. So if you were to give a thumbnail sketch of all the different kind of content you include, how would you describe that? Whitney, let's stick with you.
Okay, yeah. So I would say when we think about promoting mental health, and our biggest, one of our best resources that we have is our EAP, our Employee Assistance Program, which oftentimes gets completely lost in the shuffle if it's only discussed at open enrollment. I think an EAP is an incredible resource, but often I think utilization rates like 2 to 5% for most places. So it's not one that gets utilized very often. So each month we send out an email about our EAP, promoting it to our employees and just reminding them, here's the phone number, here's the link online, here's exactly how you can access this benefit. A reminder that it's not just for our employees, but also for their families. And we also include some communication about a different topic that we pre-plan at the beginning of the year. So, like stress management or something. So it's like every month, you're going to get hit with some communication about our EAP and what that offers. And then also, another topic in the workplace. And then as far as like providing resources, we like our EAP, but another unique offering that Big Brothers Big Sisters has, we have a trauma-informed care specialist here in Kansas City. And so this is a licensed clinician who was brought on to our staff to help serve our children and our families, but also to be available to our staff. I think it's one of the most incredible benefits that we offer our staff is they always have access to our trauma-informed care specialist. And so it's always, reminding staff that they're able to go and speak with her about anything they may be experiencing, especially as you touched on, working with families and children sometimes can be a big source of that secondhand trauma. And so that's really what she's there to address. But just reminding people that she's always available and that we encourage them to use her. Or if they're not comfortable, that we do have the EAP to find some counseling that may not feel quite as integrated into our workplace.
Yeah, it's great that you describe the resources you have available to tap into. I mean, you've got the EAP as a vendor who has information and resources as well as the services that they're providing. And then you have internal support from an expert as well. One of the things that often comes up is the challenge or the burden of having to create content for these communications. And I feel, oh, it's where do you have the time or the internal expertise or staff resources to do that? And you don't always have to reinvent the wheel. Sometimes your vendors, whether it's an EAP or your behavioral health plan, they may have information and resources you can share, or you can customize, or you can use and send out, as well as internal as well. Wendi, how about you, both in terms of the range of topics and content you're including in communications there at KPMG, but also, are you creating that content internally, or are you relying and tapping into information and communication templates from vendors? How do you put all that together?
So we do our own communications. We do like to take the content that the vendors provide and we'll put it into our format in a way that we know our people are comfortable receiving it. And we have a lot of means of communicating these benefits. We try to integrate the EAP not just in our mental health communications, but really as many times as we can, wherever, whatever benefit communications it might fit into. We recently transitioned to a new EAP provider this past June. So while we had a lot of attention during Mental Health Awareness Month, that's when we rolled it out. As Whitney mentioned, our enrollment is lower than we would like to see, so we continue to promote it. We also use newsletters. We use Total Rewards newsletter, and we include something from the EAP every month, including promoting the webinars that are available to our people through the EAP. We also have a team of wellbeing ambassadors that we promote, that we use to help promote the EAP and the sessions that are available through the EAP. And another tool that we also use before we transition to this new EAP vendor is having therapists available on site. So people could schedule, through a tool to meet with this therapist on site. We had them in a kind of out of the way location so people were more comfortable seeing them. We piloted it in 4 offices, and in most of the offices, it was very well attended, and people loved that easy access to have, to speak with somebody.
Yeah, you really highlight the importance of delivering things in the way people want. Their preferences matter. Some people want virtual resources, virtual services. Other people prefer face-to-face. Some people want printed materials. Other want digital and electronic. And in communications are always hammering in, right message to the right audience using the right channel. So knowing what those channels are really important. You mentioned some of those, Wendi, in terms of the distribution channels that you use. What are the preferred ones? I mean, you've got everything from email to intranet, the kinds of face-to-face meetings. People are using video and multimedia. They're using chat and messaging platforms. What do you find resonates the most with employees there at KPMG, or does it vary?
I think it varies, and that's why we do use a range of communications. And I didn't mention, we do also do sometimes home mailers because we know that the decision maker might be at home. We also want to make family members aware of the benefits that are available to them. So, we don't know what works best. We also have an online, Viva Engage, which is similar to an online Facebook page. So
Mhm.
unfortunately, I don't have enough data to know what really works best. But we know that everybody has a unique way of liking to receive their data, or their.
Yeah, that multi-channel communication that
Yeah.
you're describing is really key there. Whitney, what channels do you use to reach folks there at Big Brothers Big Sisters?
Yeah, so we usually use email, Teams, and in-person communication, but when we have something really important, I like to hit them with all of it. So I find it's best received when people are told in person. We have like a monthly staff meeting, and we're a small staff. We have about 50 people in Kansas City in our office, and so we all come together once a month for a staff meeting, and then once a week for a quick like burst of positivity type of meeting where we highlight our families that we're serving. And so whenever I have something really pressing, I like to first introduce it there when I know I have a very captive audience. And then I'll follow up later, usually via email. I think that's the best way to make sure. And I'll always tell people that I'll follow up that I'll remind them via email. I think if I can tell people two different ways, usually you can get away with making sure that they're really paying attention. I don't do like email and Teams at the same time because I think the two written communications would be a bit redundant, but in person and then followed up by email or Teams seems to work really well for our people. They like to hear it and then they need the reminder.
Yeah, that's a really thoughtful approach. I run into really often where I talk to leaders in organizations and they're frustrated because they say, "Oh, we send out all these communications about our benefits or programming we're doing or whatever it is." And then people say like, "Oh, like we had no idea that's going on. We don't know, we're not aware of it." And even in employee surveys, employees will say like that they don't even know that these things exist. And we have to remember that employees are bombarded with hundreds and thousands of messages nonstop, and you have to cut through the clutter, the way you describe intentionally pushing things through certain channels and using others for follow-up. Especially when something's important, it is really critical. Wendi, I'm wondering how at KPMG, I'm sure similarly people are just flooded in emails and communications. How do you cut through all that noise so that people pay attention, especially when you have something really important to share?
People are flooded with emails, they're flooded with means of communication, and they're so busy that they don't really have the time to look at it all. When there's something really important, we've had the opportunity to just put meetings in their calendar. So certain mental health awareness sessions we've put in their calendar. It's challenging to get approval to do that because you're competing with a lot of other priorities firm-wide. But we've used data from previous sessions to prove that it's worthwhile. And we're a large firm. We're around 36,000 employees and partners, but we'll get quite a bit of people for certain events. We've had like 14,000 people attend, where we
Hmm. That's impressive.
put the invite in their calendar and blocked their calendar for that event. So we find that to be very successful. Obviously, we can't go to the well with that too many times, so we hold it for the highest priority things. And another thing that I think is really successful is when we have leaders talk and share their personal stories. We do tend to get a pretty significant audience that way because people want to hear from the leaders, and it's nice to hear that they're going through the same channels or challenges that we are. So that's proven very successful for us as well.
Yeah, so many good things coming up here. I mean, I love your example of using data to get buy-in and support from leaders. I mean, when you can show using data that there's a need, there's an interest, when you can demonstrate it and get the sign off to be able to do something like that, that's really powerful. You also talked about the importance of engaging leaders and having them communicate and share their stories. What approaches did you use to get that leadership engagement? I mean, sometimes that's easier said than done to get those leaders to actively communicate with employees about mental health. Like what's worked for you to get that done there, Wendy?
I think it's just leaders making some people aware that they're going through these challenges. It just gets to the right people, and then we're able to ask them, would you be comfortable doing this kind of session? We had a really successful one that some of our partners did. I think we had 3 partners lead it about substance use disorder. And one of them had a personal story, another one dealt with a family member. So that was such a raw and great session, and garnered so much feedback. So I knew that that was, really well done. But you're right, that's kind of hard to know, like who's the right person to lead that kind of session. Not everybody's forthcoming that they're going through those challenges. So I think just creating an atmosphere around the firm that, we support you. We know everyone's going through something at some time or another, and it's, might be you, might be a family member, and we support you. And I think that makes people comfortable coming out and sharing their challenges and hopefully
Yeah,
share.
those leadership messages can be really powerful. And there are a variety of ways that senior leaders can communicate. It may be sharing their stories like that. Some of it is just highlighting that mental health is a priority for the organization and conveying to the workforce how mental health connects to and links to the organization's ability to pursue its mission and to serve its customers or clients or communities effectively. So it's not just a benefit off to the side, it's how we do business and how we're more effective and successful and how we take care of each other. So Whitney, I want to go over to you on that topic. How at Big Brothers Big Sisters Kansas City, how do you engage leaders in communicating around mental health to the people who work there?
Yeah, so I think the first part is getting leadership on board, and making sure that all of our leaders agree that mental health in the workplace really matters. We have a lot of very empathetic people that work at Big Brothers Big Sisters, and our leaders are the same way. But I think it's always helpful, like Wendy had mentioned, showing data, right? And so I'm always looking to take different data from our employee engagement surveys, and then also, fortunately, having the visibility into the financials as well to just show like the true cost of turnover when people don't feel cared for, when people do experience that burnout and don't feel they have the right supports in place. I think being able to show, a dollar amount that's associated with turnover and what can be associated with lack of mental health support really motivates our more financially sound leaders to agree that like this is really important and we do want to take time to discuss mental health. And so I think that's kind of where we start is in making sure that everyone agrees why it's important and what the priority is. We also, I mentioned our monthly staff meetings that we have. Everyone attends those. Our CEOs never missed one. No one's too busy, to send the message that no one's too busy, no one's too important to not attend those meetings. And that's where we do our training. So that's when we do the preventing suicide training. That's when we do how to best work with individuals that are battling depression, by always having a strong leadership presence, because it's one thing, right, for us to say like we care about mental health, but it's another thing to sit in a training that can become vulnerable when you're sharing personal stories with your leaders, and seeing them right alongside you. And so we do a lot of that as a full staff. And then we also do a lot with just our leaders, those that are managing others, making sure that they're receiving all of the additional trainings about just how to recognize any type of mental health issue in the workplace. And again, all of leadership is always present at those trainings, doing it together. And I think that sends a powerful message, even if we don't necessarily have a leader who's sharing a personal story.
Yeah, I mean, a lot of great points in there. I mean, you really hit on again back to the data piece, which I can never stay too far away from like use of data. It's something we hammer on all the time. And, like you use the data, but you tied that into knowing what are the metrics, what are the outcomes, what's the data that matters to leaders in the organization. And for it'll vary person to person and role to role. Some will care about the financial implications. They'll care about turnover or time people are out on leave or healthcare costs. Others will focus more on client or customer satisfaction or community reputation or those kinds of things. And knowing what those metrics are that the leaders in the organization care about, then you can frame your messages around that to them, just as you described. I thought that was a perfect example. Whitney, you already started getting into this topic a little bit, but I'm wondering if you could talk a little bit more about it. I'm wondering about segmenting your messages. So, you were getting at talking to senior leaders about it, but then you also talked about managers and supervisors and needing to talk to them in a different way. And then obviously talking to frontline employees and even volunteers in an organization is going to be different. So how do you segment and tailor those messages to different groups so that it's going to resonate with them and really get at things that fit their needs, their perspective and that they can apply in their particular role?
Yeah, I think it's taking our baseline mental health in the workplace communications that everyone should be receiving those. And then it's
Mhm.
making sure that we feel comfortable that what we're providing to every employee is satisfactory for us, that we are
Mhm.
communicating that they are understanding the importance, that we value it, and the resources that are available to support them for all employees. As a baseline. And then we look at different groups. So we know that our managers need training on how to support people through various crises, what to do, who to turn to when something like that happens. And so that's another, that's one of those segments that's carved out where we're going to provide them with additional communication resources. We're going to provide them with, we're big on training. We're going to provide them with training to be able to make sure they're able to support people. And then when we further look at like our different frontline staff, our staff that are engaged with families and children doing our direct service work and recognizing the toll that can take on them, that's where we really focus, like our trauma-informed care specialist,
Mhm.
our, hiring that trauma-informed care specialist actually came as a result of some employee engagement survey feedback where our people were feeling ill-equipped to handle certain high trauma situations, and it was really taking a toll on their well-being and their mental health. And so it was incredible as a leader to get to say, we hear you and here's what we're going to actually do about it. And so we like to make those bigger communications to everyone. But again, we're constantly looking at each group. We're saying what are we getting out of our people? And we can do that sometimes by doing like a quarterly pulse survey to see how people are feeling. And if we, set up the survey correctly, we can tell which departments may or may not be struggling more than others, and how do we need to respond to that department. I think it's also important that we are working directly with those department leaders, that it's not, just me or someone else in a bubble saying like, I wonder what this group needs, but actually talking to the managers or talking to the people doing the work to get their feedback on how we can support them and then going from there.
Yeah, that's great. Ultimately, the communication also has to include upward communication so that the messages you're crafting are going to land. Otherwise, how do you know? You might think this is great from the top, and then you send something out and could totally miss the mark. So, Wendy, how about you at KPMG? How do you segment your communications, and how do you tailor them to different groups, whether it's senior leaders, managers, frontline employees, consultants, so on?
There's actually a team that we have in our learning and development group that focuses on partner well-being training. So when the partners are together in our training development training facility down in Florida, there's sessions that they go through really just about well-being, and then we encourage them to stay together as a group to talk about how things are going, what's working well for them, what's not working well, reach out for help, reach out for refreshers on anything new well-being. So that's how we work with our partners. We also have leadership training available through our training catalog that people can take on various things well-being related. There's another one that's coming up that was just developed about dealing, recognizing when somebody's in distress and how to deal with it at that point. So we try to, refresh the training sessions that are available. And then really just with employees, again, integrating all of the benefits and messages that we can about well-being using our EAP into as many communications as we possibly can. And another area that we work with is our vendors. So we've cross-trained our vendors to understand all the benefits that we offer. And, if somebody is calling our health carrier talking about a recent diagnosis of cancer, well, make sure that they offer our EAP to that person, and then the other benefits that we offer that might support their unique needs. So we did that with a vendor summit, and each vendor did a deep dive in the benefits that they offer and how can they cross support each other or our people through each other. So that was really worthwhile.
Yeah, that's so important, that integration and alignment of the various vendors. And it's something that doesn't happen very often. We talk to organizations and they may have a lot of vendors that they're working with, but they're usually silos of various benefits and offerings and things that have been added over time. They usually don't talk to each other. And they're most effective in the kind of case that you just described, where no matter where somebody enters into this whole system of benefits and resources, whatever the touch point is, it sort of spider webs out and connects to all of the other benefits and resources. So like you said, if you tap in over here, say somebody is coming in through short-term disability, they're out on leave for something, that as they're coming back to work, they're getting connected to the EAP and other support resources and sort of warm handoffs across all of that, so that it works better than these one-offs. So much of the time, as you all talked about at the beginning, there are great resources that are underutilized. Typically EAP is about half the utilization that would be ideal within an organization. So there's a big need there. That was a great example of that. Wendi, why don't we stick with you for a minute? Because I want to talk a little bit about frequency and cadence of communications. We talked about needing to cut through the clutter, make sure people are seeing information. How do you make sure that you're communicating enough without it being too much? Where's that balance of getting people to see the messages without it bombarding them with so much that they're annoyed by it?
Yeah. Well, the good thing is they probably don't see all of them, so they don't know that they're getting too many. But I would say, we've tried to have at least a monthly cadence of communications, and through some of the newsletters that we do, that's one means of getting the message across monthly. And then there's also things that are going to come up that excuse me, that we're going to need to provide, ad hoc resources that we weren't anticipating. We have an office at 345 Park Avenue. There was the shooter there, and that was quite stressful for our people. So we pivoted, and our vendor was wonderful in supporting our needs. Like immediately, what can we do? And they were on site for us in New York and in local areas as well. So our goal is to communicate at least monthly, and then be available for critical needs as necessary.
That's like
Great.
exactly what we do.
Yeah.
When you were talking, Wendy, I was like, gosh, that's pretty much exactly where we're at with monthly communication, always feeling like the right amount and then being able to reach out as things happen. I love that example about being able to have someone come in on site and help triage when necessary. That's similar to an approach that we would take whenever something happens in our community. Then we ramp up communication and make sure that we're responsive. But I think to get people engaged, we have to make sure we're not bombarding them constantly. One thing I always try to remember is that like my number one priority isn't going to be everyone else's number one priority, and just really respecting avoiding that cluttered inbox feeling has been helpful. So people are more likely to actually read what we're sending when we do send something.
We also use messaging that we don't expect you to remember all the benefits that we offer, because what we send out might not resonate with somebody at the time, and so they might not pay any attention to it. But think of KPMG when you have a need. We most likely have a benefit that will support that need.
Yeah, that's the pushing information out is important, but so too is people being able to find the information they need when they need it and making it easy for them to do so. I mean, the last thing you want is somebody to be struggling and completely overwhelmed, and now it's a complex, cumbersome process where it's difficult to find the information. I mean, that's exactly not the time when you want that to happen. Whitney, I want to go back to that feedback loop that we talked about a little while ago in this conversation. That upward communication from employees. How do you use input and feedback from people who work there to inform your communications, your offerings, the things that you're doing? How does that employee feedback get incorporated?
Yeah, so our biggest thing, and I've touched on this before, we really rely on the results of our employee engagement survey. Again, being a really small company with 50 people, the last like 5 years, we've had 100% participation rate in that survey. And so we feel really confident that those results will be helpful. And we ask really specific questions about, rate our communication on a Likert scale. How can we improve our communication? And asking people like, do you understand the benefits that are offered to you? What benefit would you like more information about? I mean, ad nauseum, we ask so many questions about, we have a full communication section on that survey. And so I'll take, we're coming up on that time of the year where we'll do our survey now, and then I'll take those results to lay out like a planned communication for our monthly communications next year. And so I think people are very responsive when they feel they've been heard from what feedback they've provided. And then we also like just touch base informally. Again, being smaller, I'm fortunate to be able to go and meet with our staff. I usually try to meet with one person each week and just see how things are going. And that's when I get a lot of really good feedback from the people from a one-on-one meeting. And they'll tell me like, oh, but this was hard. And I'll say, oh, well, do you remember we have X, Y, and Z benefit available? Or they'll tell me about maybe a challenge another person they're aware of is facing. And so then I can push out some communication that may be relevant for that person. But it's just continuous. It's like always trying to figure out what people need and how to get that to them. But I really think we just have to keep asking, and we have to ask in different ways.
Yeah, it's definitely an ongoing process, and that combination you described of the quantitative and qualitative. So you're measuring things, you're asking about in a survey, so you can track how things are going over time. But then you're following up qualitatively, so you paint the picture, you get the more detail that you need to find out about, and you personalize it in those kinds of communications that you described. Wendy, how about you? How is employee input and feedback used to shape your communications and initiatives there?
So we also use pulse surveys and a global people survey. So we do a lot of listening through that. And then we have, I think, about 8 employee resource groups. So we have somebody from Total Rewards is aligned to each business resource group so that we can participate in their sessions, just make our presence aware. What can we do to support you? What are your needs? What are your people saying? And that's been a really great exercise. And I think we're reaching a lot of people through doing that. So, Whitney, I
So,
saw you think in your head that you might be doing the same thing.
Just listening, but I'm actually shaking my head like, gosh, 8 employee resource groups. That's incredible.
Yeah.
Um, so Wendy, staying with you for just a minute, when you think about all the communications that you do and all the initiatives that you have in place and dealing with the size and scope of the workforce there and the complexity, is there a particular success or challenge that you've experienced when it comes to communications, and how has that influenced the way you do things today?
Just being okay with, we're just going to get people that are interested in the particular topic. We're not going to get huge numbers, by a percent of 36,000. It's hard to get a lot of participation. Plus, our people are so busy. They're not necessarily available for all of these sessions. So, we try to make playbacks available. For Mental Health Awareness Month, we'll do we'll provide office guides for somebody from the office to, get together with a group of people and facilitate conversations about the specific topic. We try to choose a relevant topic each month, or I'm sorry, each year for Mental Health Awareness Month. And, just have people word of mouth telling their coworkers or their colleagues, this is the session that I attended, it was great. And, just encouraging people to talk with each other. So, it's a challenge to get to all of our people, and there's a lot of different ways to communicate to them, and we're not going to get everybody all the time. So,
Yeah.
we're happy with, a few thousand would be wonderful.
Yeah, good point. I mean, there's such a wide range of topics and things that are relevant to different people that covering those, especially in a large organization, can be especially challenging. Whitney, how about you? Any particular successes or challenges you faced around communication and your mental health initiatives, and like how has that shaped what you're doing today?
Yeah, I would say even though, our scale is completely different, what Wendy said about word of mouth is what we sure find to be really powerful as well. And we can kind of tap on people that are like champions more or less and ask them to do the communicating. It really goes a long way. And so while I can, sit here and tell people how great the EAP is and they should use the EAP, having someone who's actually used the EAP that's on the front line, being willing to say, hey, oh yeah, I used the EAP and I had a good experience, that's gone a lot further. So I'd say a lot of our communication successes and challenges, it's all trial and error. And looking to see, oftentimes, I think it's who's doing the communicating. Where we've had our biggest challenges, a lot of frontline workers too would prefer communication from our trauma informed care specialist because she's seen as more of the expert on that than I am over in HR. And so the more we can have our people that are like peers communicating to their peer group about different experiences they've had firsthand, the better and more successful we've seen our initiatives become.
Yeah, from both, as I listen to both of you in this conversation, what I hear out of this is that effective communication is both an art and it's a discipline. I mean, you're planning and you're structuring things, but it also takes some creativity and some flexibility around it. It's about having a clear plan, but also adapting to the needs as your workforce needs change or something happens in your environment that you need to respond to. It's about leadership showing up, not just sending messages, them actually being part of the conversation and making those connections, and making sure that communication is relevant and covering the topics that are important to different segments of your workforce, so that employees are really seeing the full picture of mental health. It's not just the benefits communication that comes out around open enrollment. It's an ongoing campaign that will continue to evolve in sort of a living organic way as you move forward. I'm going to jump to some questions from the audience because we've got some things that I see sitting in here that I want to make sure we have time to get to. So let me pop those open here. I've got a question here for Wendi asking more about your mental health ambassadors program and like how that works and who the ambassadors are. Can you expand on that a little bit?
Sure. So there's somebody who was trained in mental health psychology, who works at KPMG, and he was interested in facilitating a group of well-being ambassadors. So we were just very lucky to have him and have his ability to coordinate that group. They meet on a monthly basis. It's a small group, about 20 ambassadors. We've provided them with mental health first aid training. They meet monthly to talk about relevant topics, how they can coach people. We've approved for them to meet with people on a basis so that they can provide one-on-one coaching. So, for example, I could speak with one of these ambassadors. They could coach me on a particular challenge that I'm having. So, that we're still doing that as a pilot, but, it's just an engaged group and, another group that we can use to help promote our benefits and our well-being communications.
Great, thanks. Here's a question for both or either of you. Do either of you use specific channels to reach high risk or hard to reach segments of your population?
Oh gosh, when I think about individuals that are a little bit harder to reach, and especially those that, maybe out in the field and a lot less plugged into their email, I try to push things through their manager. And so I know all teams are having, regular touch points with their manager, but if I feel like someone is at a higher risk for something, I'll send that communication through their manager and give them a lot of coaching on how to deliver something.
Thanks. Wendy, anything you want to add to that?
Well, I love what you just said, and I'm going to see how I can integrate that at KPMG. But, I would say our people are online all the time. They're always on email. We have an intranet, and the information that we push out is on our KPMG Today on a daily basis if there's anything that we need to communicate, but also on Fridays, there's Fast Five Fridays. So that's, information that we will highlight to people. So I think all of our people are high risk at one point or another because of the stressful environment that we work in. Um, and we don't have any unique channels that we really reach out to them in.
Thanks. There's a question in here about influencing the organization's mental health programs or communications efforts from a middle manager position. So if somebody's in a middle management role, so they're not a senior leader making the decisions, they're not one of the ambassadors in sort of a grassroots network, but they're in that middle manager role, how can they have influence in affecting and shaping what's being done in terms of mental health?
I think as far as supporting their team, they can just be aware of what their teams are experiencing, any challenges that they're noticing, and just take note, put that information together, and escalate it to their leadership so that they can say, this is what this is what I'm experiencing, this is what our people are experiencing. And I think if we were able to solve this for our people, then we could change the culture.
Yeah, I would say the exact same thing. And I also, again, with being smaller, I would love it if somebody came into my office and said, like, here's what I'm seeing, and here's a few ideas that I have. Oftentimes we get a lot of things like observations are presented, but not necessarily solutions or ideas for changes that we can make. And I would just so appreciate someone coming to us with that feedback.
I've got a question in here for Wendy, and it actually comes from Catherine Gunther from Mars, who happens to be the chair of One Mind at Work's Global Guiding Council. So always good to have a question coming in from her. This is directed to you, Wendy. As a global organization, do you have different approaches for how you engage employees in talking about mental health and reducing stigma? For example, Asia Pacific, it might not be part of their culture to disclose how they're feeling. So how do you reach this or other regions where mental health has differing levels of acceptance?
Yeah, I'm sorry, I don't have a good answer for you because I just work with KPMG domestic. Um, we do sometimes connect with other countries, KPMG and other countries, to hear what they're doing, what's working well for them, what's not working well. So, we'll stay in touch with them, but our reach is not global at this point.
Yeah, some of the cultural differences. One of the challenges is always maintaining sort of an umbrella strategy and plan while giving enough flexibility to tailor for a particular culture or location or environment. We've worked with some organizations that are in 10 or more different countries simultaneously, and maybe very different from one place to another in how they talk about it, where the leaders are still trying to tie it together into a coherent communication plan or a mental health strategy that's affecting the same change, but maybe needs to be done in different ways, location to location. There's a question here about the use of AI, which is coming up all of the time. We talked about newsletters and information and messages being crafted, and there are a lot of people using AI to craft these kinds of messages. And so this question gets at, how, if you all are using that, and how so, to make sure it's avoiding that sort of cold, sterile lack of empathy, something that's spit out of a formula versus something that's crafted as more of a human connection from a real person. Are either of you balancing and using those kinds of technologies and tools?
I'm dipping my toe
I
in it. Sorry, I'm dipping my toe in it, but I know that one of our vendors is using AI to create messaging for different generations to be attractive to different generations. Right now, I'm just dipping my toe in it. So.
Yeah, I love using AI. I use it before sending most communications to as just like a review, make sure what I'm saying is making sense and ask for feedback from AI. But before I would ever send anything, I'm going to read through it and imagine being the person on the receiving end of the communication. But I do think AI is going to have a big role in mental health in the future, and different benefits that are provided. And I think AI has a lot to offer us. And so even though at first I was hesitant, I really try to embrace AI and see what it can do for us, how it can make things a little bit easier because it sure knows a lot more than I do.
We have time for, I think, one more question out of the Q&A box. We talked a little bit about it in the conversation already, but I think it's worth going back to for a minute. You clearly have buy-in from the leadership there, and you've taken steps to build that and to get support and use data. But there are many organizations where the senior leaders are not engaged yet. They don't have the buy-in. So the people running the programs needing to get that senior leadership buy-in and engagement. Do you have tips or suggestions for those who don't have that yet and are really needing to build that as a foundation so their programs can be more successful?
We worked with one of our consultants on a study, a mental well-being study, and it included, digging into our data, our PTO utilization, our utilization data, how productive are our people. It included surveys. So we just used a ton of data for this study, broke it down by different areas, different levels within the firm, where are people struggling, and that's real data that the leaders have to pay attention to. And so we developed a well-being strategy based on the results of that survey, and the results and the data that came from that were just so impactful that we were very lucky to get leadership buy-in. But I would say, doing a study like that's real. That's showing what your people are struggling with and where you should spend your time and effort.
Yeah,
Thanks.
I agree. It's just turnover is so costly, and looking at what your people are struggling with, finding data like Wendy was saying, and finding a way to tie it to the bottom line for those that may be more financially in tune than concerned about well-being.
Great, thanks. We're hitting the end of time. We could spend another hour talking about this and fantastic examples. But before we close, though, I want to leave folks with one last story about communication that ties into some of the things we've been talking about. And this relates to what happens when we get the message wrong. So a number of years ago, the Parker Pen Company had an advertising communication campaign going, and they were trying to expand their business into Mexico. And their slogan in English was, "It won't leak in your pocket and embarrass you." So they're translating their campaign, and they're working to apply this in Mexico. So they translate this, and while on the surface of this looks like, oh, this probably looks like it would be about right, except when translated into Spanish, the slogan actually came out as, "It won't leak in your pocket and make you pregnant." So the company knew what it wanted to say, but it didn't really think about how it would get interpreted, how it would be understood. And that's sort of the perfect metaphor for some of what we were talking about today. We might have the very best program, the very best data, the best intentions with what we're doing, but if we don't think about and tailor our messages for the audience and make sure that it resonates with them and their culture, it can completely miss the mark. So communication isn't just about translation. It's about how we connect with people, making sure that people actually hear the messages we're trying to convey in the way we mean it and in a way that resonates with their experience and their culture. So I want to thank both of you, Whitney, Wendi, for sharing your insights and your thoughts. Thanks to everybody who joined us today. You can download the Fall 2025 Focal Brief at mentalhealthindex.org. I encourage you to share it with your organizations. There's lots of good information in there. And remember, when it comes to mental health at work, communication isn't just what we say and what we're talking about. It's how we make people feel seen, how we help support them, and how we make them feel understood. So thanks again for being part of the conversation, and be well.
Thank you.